Okay, hi everyone. Good morning. I'm going to wait for a moment for everyone to be properly connected. I know it can take a little while to be fully in the room on these Teams calls. But if you're hearing me, don't worry, we'll be starting very shortly. Hopefully you can all now see the slides that we're going to be presenting through the meeting. If you can't see the slides or you can't hear me, then please pop a note in the chat. We'll try and support you with tech. Of course, if you can't hear me, I'm not quite sure how you'll know to do that. So I'm taking this on trust. Anyway, good morning or good afternoon, I should say, everybody. I'm Chris Graham. I'm the Group Chief Executive at Picker Institute Europe, and very happy to be here today chairing this webinar about how to write a successful Picker Experience Network Awards entry. This is a webinar that we've been running annually for the last few years. I think this is our fourth iteration now. And really the goal is to give you the information and insight that you need to put together a really high quality, compelling submission for the PEN Award that will give you the best chance in showcasing your work, of getting it noticed, hopefully getting it shortlisted, and maybe even winning. I'm delighted to be joined by colleagues here today. So we have Ruth Evans, MBE, who is the founder of the Patient Experience Network, which has become the Picker Experience Network as of 2024. Also joined by Helen Brady, who's going to be providing support on the slides and on the running of this webinar throughout. And our chair, Angela Coulter, is here too, and we'll be speaking a bit later on. We also have support from Sue Cowap, who I think is not on screen but is in the chat and will be helping with any queries that you might have there. And then we're joined by three external speakers, Asmina Rose, Darren Hudson, and Kate Tanton, who are going to be giving you some insight throughout the day. I think a couple of things to mention as housekeeping just to get us started. First of all, we are recording this session. As you can see from the top left of the screen, we're live, we're recording now. If you don't want to be recorded, then obviously just keep your camera off. But otherwise, you're part of the meeting and you consent to that by being here. Second interaction, we very much encourage. If you would like to share anything with us, there's two ways you can do that. There is the normal chat functionality for Teams. Please do feel free to drop a note in there to introduce yourself and say hello. And if you have any queries, any technical issues, do flag them up in there. Do consider @ing Sue Cowap so we can support you as quickly as possible. There is also the Q&A tab, which one sees on webinars and so on. The Q&A tab is especially useful for us if you want to raise any questions for the Q&A that's going to be at the end of the session. What we're going to be doing throughout is we're going to be holding queries and questions on all of the different presentations until the end. We'll take them all together. So if there's anything that you want to ask one of our speakers or the team in general, please do just drop that in the Q&A as we go. This recording will be shared after the event, so thank you for that question. We'll be putting that on our website as early as possible, so you'll be able to share it with colleagues and refer back to particularly relevant moments as you wish. I think that's really all I have to say by way of general introduction. I want to hand over now to Ruth Evans to tell you a bit more about the Experience Network and the awards. Ruth, over to you.
Thank you, Chris. And first of all, may I join Chris in welcoming you today and thanking you for joining us, particularly during Patient Experience Week. And it's our first time to do this in Patient Experience Week, and we just think it was the perfect time to talk about best practice. So as you heard, I'm one of the founding directors of PEN, the now Picker Experience Network, and we are 15 years young. This is our 15th year of running the awards. And as Chris said, this is the fourth time that we've run this webinar. And I absolutely love this webinar. I think this time of year when you're thinking about and reflecting on your best practice is perfect. It's a real chance to celebrate what's working well. I love the fact that we get under the skin of what our judges are looking for. And you've got 4 judges today who are going to give you some fabulous insights into what makes it a great submission for them. And I love the excitement and the anticipation. And we're expecting a lot of people online today. And just joining in that joy of focusing on what you're doing well and that anticipation of being able to recognize and celebrate with your people is what the Penn Awards are all about. So that's really all I'm going to say, because it will become much, much clearer as you're going through, other than to remind you that as you're listening to the judges, just think about, well, what is the best practice that you might want to submit? We do have a lot of categories. We have, I think it's 22, plus some individual categories. So whatever your best practice, there will be a category for you. So don't worry about that. We can help you. But the key thing today is really thinking about, well, what is it that we're doing that we should be recognizing, celebrating, and sharing, and really giving your people the chance to be known for what they're good at. So that's what the Penn Awards are about, and I'm going to hand back to Chris to introduce Angela.
I think I'm going to talk through our judging criteria first, and then come back to you, Ruth, and then we'll go to Angela. I hope that's correct, but someone can hit me
No,
under
you're
the
right,
table
of
if I
course,
do.
Chris. I'm jumping the gun already.
Okay, no problem. So I'm going to talk for just a few minutes about the judging criteria. And it's been a real privilege of mine to have been involved in judging of Penna for some years now, since before the pandemic, another lifetime. I've seen some great entries in that time, some real standouts, some that are incredibly memorable. And I hope from that I've got some insight into what stands out and catches a judge's attention. I'm going to just talk you through that. Um, First of all, next slide, please, Helen. Um, as a CEO, I'm contractually obliged to include in all of my slide deck a couple of slides about my organization and what we do. So this is a little statement of our vision and mission. Our vision is of the highest quality person-centered care for all, always. And beneath that, a little bit of detail about what we do. Although in a nutshell, we support organizations, professionals, policymakers to understand, measure, and improve people's experiences of care. And that's where the Experience Network Awards really fit in this. It's celebrating and recognizing improvement and best practice that can really transform the quality of person-centeredness. Next slide, please. These are all principles of person-centered care. This is an evidence-based framework that's recognized internationally that describes what matters most to service users, their families and staff. If you're thinking about how to frame and contextualize your submission, there are worse places to start than this. It's because this gives an understanding of what people's priorities are when they use health services. And if you can demonstrate improvement against these categories, I think that's a very, very valuable thing to do. So take that as a starter for tech. And then beyond that, we'll start to look at the specific criteria that each of the judges are going to use. Now, for Penna, we have a wide pool of judges, which include past winners, experts from the world of academia and from health service delivery, patients in the public, and so on. And all of those people are using these same 5 judging criteria to assess every entry. We're looking for new thinking. We're looking for leadership. We're looking for entries that demonstrate impactful outcomes and sustainable change. We're looking for entries that show involvement of patients in the public and an inclusive approach to their work. And finally, we're looking for entries that can show transferability and are supported by good dissemination. In other words, we're not hoarding our knowledge locally, we're sharing it with others and inspiring change elsewhere. For each of these, we're using a 0 to 100 marking scale. So judges have a lot of discretion here to assign marks, but this is the guidance that we're all given. At the top of the scale, we're looking for outstanding entries that have fully evidenced their descriptions for each of the categories and that give a compelling account that persuades us very strongly. If the evidence is more patchy, then or if it's not as persuasive, then we might use a lower banding. All of that scoring then is combined into an overall score for each entry, which is used to help rank the entries. And we take averages across the different domains and across the judges in order to get to total scores for everyone. So a lot of kind of quantitative data going into this, but alongside that, a lot of qualitative information, because judges write comments and often quite thorough comments, which are then shared back to entrants, and we think that can be very, very valuable as feedback. So that's another reason to submit an award. Submit an entry for awards consideration. Let's turn to each of the 5 categories in turn now, and I'll do this rather briefly, but of course this is recorded. You can come back to this as you wish and look through these. Essentially, for the new thinking category, what we're looking for is whether things are different, innovative, ambitious. Do they stand out? Are they novel? That novelty could be, a global novelty. It could be something that no one's ever done before, or it could be bringing a new idea into a setting that hasn't previously trialed it. You could be first in sector or first in organization. So we're fairly open about what novelty means. What we certainly want is for entries to stand out. We want them to be different from normal practice. We want them to use creativity to solve a problem. And above all, I think what really stands out for me is when I read an entry and I think, gosh, why isn't everyone doing this? It's the ones that make you think this is such a brilliant idea and such a perfect fit, and that make you think there's scope for adoption by others. So that's the new thinking. The second category is leadership. And this is about the quality of management and project leadership. We know from research that if you want to affect improvement in person-centered care, if you want a more person-centered organization, there are a set of things that enable that, and one of the key ones is leadership. And that means leadership at all levels of the organization, from senior management through to wards and operating rooms. And in the context of the PENA, we're looking for high quality project management and high quality project leadership. That doesn't necessarily mean you need to show that your board or your senior team have backed the project, but what we want to see is that the people who've been involved in it have had a good grip on how the project's running, they've planned it thoroughly, and they've executed well against that. We're particularly inspired by entries that show continuous learning. So when you can look at what's gone well in a project, when you encounter challenges, respond to those and progress accordingly. That can be very, very valuable. Next slide, please. Impact is really important. And we love to see robust assessments of impact. Now, that doesn't need to be statistical, and it doesn't need to be quantitative. Some of the best examples that we see are qualitative. They can use stories from patients and the public or from members of staff, and that can really bring to life how a change has affected them. As a general piece of guidance, though, if you can include performance measures, please do. If you can include narrative that describes a positive change in people's experiences, please do. But above all, make sure that feedback relates to the aims and objectives of the project. Show that you've achieved what you set out to. And finally, tell us how you're going to sustain this. There's no point having an incredible intervention if it's so expensive or so prohibitive in terms of burden that it can only be done for a few weeks. We want to see things that can stick around and continue to make a difference for people. Next one, please. Involvement and inclusivity is something that's very dear to us at PICA. We talk about the highest quality person-centered care for all, always. The for all is not accidental, and it's not an afterthought. Inclusivity is at the core of what we do, because person-centered care is for everyone. And if any of us are not equal, then none of us are equal. So we're looking for initiatives that show the involvement of patients, carers and families in co-design and co-production. Now, it's not always possible to fully achieve that, depending on the scope of the design, but it's great to think about where that can be included and give us evidence of it. And we're also looking for projects that take into account the needs of diverse groups and look at people from different backgrounds, thinking about cultural factors and thinking about the potential to address inequalities in the system. Next one, please. And the final category is about sharing and dissemination. The best projects are one that have the potential to be picked up and adopted elsewhere or that already have been. If we see initiatives that can be spread and scaled to other sites, that's very powerful. So we love to see teams taking an active approach to sharing their messages, encouraging others to adopt them, and sharing that innovation. What we want to see is a kind of Steal with Pride ethos, where we encourage people to adopt best practice for the good of patients and the public. Next slide, please. And I think this is my final slide. This is just a summary. And if you take one thing from this brief talk, this slide is the one. This is a summary of the 5 categories we're looking at and the criteria we're rating them by. Please do keep this close to you as you're preparing a submission. Think about having this to hand so you can refer back to it. These are the 5 things that we really want to see. New thinking, leadership, strong, impactful outcomes that are sustainable, an inclusive approach to involving patients in the public, and a commitment to spread and share. Thank you. I think I've run over time, so I'm going to very quickly hand back to Ruth to tell you a bit more about what sets entries apart. Ruth, over to you.
Perfect. Thank you. So fabulous to see so many people join us today with some new names, many new names, and some familiar names. As we're going through the conversation today, if you do have any questions, please do let us know. Let us know in the chat and we'll answer as many questions as we can. We're here today to really help you understand the awards and how you might want to enter. And I think what I wanted to do was think about the entry considerations and what sets entries apart from each other. And you will hear from our judges and what they're looking for. But time and time again, we hear a couple of very consistent messages from our judges. And we see it through the submissions and the ones that start to win. We see and hear that the submissions that set themselves apart, or the entries that are a little bit different and make our judges sit up, are the ones who've genuinely included the patient and colleague voice in their submission. So what was the problem that you were solving? How do you know? What is the impact and how do you know? And often that's through the stories or the verbatims, the comments, the anecdotes from your patients and your colleagues. Interestingly, as you've heard from Chris, we are looking for evidence of impact, and it's an area that we do see that can get missed. And as Chris said, this is not necessarily statistical data. It's about, well, how do you know it's made a difference? How do you know it's made the impact? And that evidence of impact is really important so that people can understand, well, did it do what you set out to do? Or indeed, were there some unintended consequences, which are always really interesting? And that evidence of impact is really key. And finding a way to make sure that you've covered that clearly and concisely in your submission makes a difference and sets entries apart. Ultimately, this is about you telling your story. We hear from our organisations who take part that actually this can be quite cathartic. It can be quite an activity, an event in itself, just completing the submission form, because it gives you a chance to come together as a team and really reflect on what it is that you did, why you did it, how you went about it, what lessons did you learn on the way, and what difference did it make at the end of the day. And that process in itself can be really, really powerful for the people who take part. And we do hear that time and time again. But as you're thinking about filling or completing the form, it is staying true to your story. It is your story. So we see and we know that entries that set themselves apart have managed to capture that essence of what it is that you did. And as I've said now a couple of times, whilst the form may appear to be any form can appear difficult, can't it? It's not intended to be there as a difficult thing to complete. It's intended to be there to help you capture what you've done. So if you're finding at any stage that the form has got in the way, just let us know, because we're here to help you. And ultimately, it is about simply capturing what you have done and why that's made you proud of the work that you've achieved. Please ask questions. ask questions today. Helen's popped into the chat. Please ask questions of Helen. We've also got a form on our website at it's actually still patientexperiencenetwork.org, but you can contact us through there, and we have a team of people also available on awards at PICA Europe. Again, Helen will put that in. So you've got many ways, or you can simply call us. We're more than happy to chat. But if you feel you've got something that's worth sharing, those are the things that we have been seeing and hearing time and time again tend to set entries apart. And I think sometimes in the pressure of completing a form, you forget those things. So don't forget them, and let us know if you've got any questions. Now I'm going to hand back to Chris, who I believe this time will introduce Angela.
Yes, that's absolutely correct, Ruth. Thank you very much. It's really helpful. Next up is Angela Coulter, who's the chair of the board and former chief executive at PICA. Angela, over to you.
Thanks, Chris. I was a judge on last year's awards. In fact, I've only done it once, but it was a very interesting and somewhat challenging experience. But the prize for me was attending the award ceremony, which is wonderful. It was really such an inspiring day. So there are lots of judges involved. Ruth and her colleagues make us all work very hard. So when writing your application, it's a very good idea to sort of tell a good story, something that will make the judges' hearts sing. And I found that happened quite often. And actually, the most difficult thing of judging was deciding, you know, which ones didn't quite make the mark. The ones that made my heart sing were well written. They didn't include any waffle. The waffle had been, if there had been any, had been cut out. They were very clear. A clear statement of the problem that you're trying to solve, or the goals that you're trying to achieve, is very important. And as Ruth said, that really does have to be related to patients' experience. If you've involved patients in finding the solution to the problem, that's particularly good, and we love to hear about that. Then you need to write a very clear statement of exactly what you did. And then what we're looking for is a clear set of outcomes. So how do you know that what you did actually made a difference to the particular problem that you were trying to address? That does not mean that you have to do a research project. In fact, we're not looking for research projects at all. We're looking for evidence, and this evidence should be evidence that's readily available to you. So almost all organizations have some kind of patient surveys, for example. Use that if you've got that. And if you can do it before and after, so if you can really show in some clear way that what you did made a real difference, as reported by patients, then that's best of all. The other thing that I particularly look for is, what did you do to spread your good ideas? So both within the organization, within your own organization, who did you tell about it? Have you persuaded others to take it up? You may be writing just about some fairly small project that happened in one ward. What did the other wards do? Did you tell them about it? Did you get them on board too? And even better, if you also managed to spread your good idea across other organizations beyond your organization. Tell us about that too. So you don't have a huge amount of space. So you have to be very careful about what you write, and don't put in anything that's not necessary, but do tell us about those things. And that will make us as judges thrilled to have you on board, and put you high up on the list of contenders for awards. Thank you.
Thanks, Angela. That's really helpful. And I think that's such a good guide to it. You know, what inspires us, what makes your heart sing. Really, we want to see passion, and we want to see evidence of real improvement for people. So very valuable guidance there. going to move on now to our external speakers. Before I do so, just a reminder, we have the Q&A function. So if you have questions that you want to ask, either for particular speakers or for the panel in general, do drop them into the Q&A. You can also drop any technical questions into the chat, as some people have already done. First up from our external speakers, though, is Azmina Rose, who's the Personalised Cancer Care Lead at the Royal Free London NHS Foundation Trust. Azmina is going to talk about her experiences as an entrant and as a judge. So Azmina, over to you, please.
Thank you for having me, and thank you for that introduction, Chris. I hope you can all hear me okay. So I'm Azmina, one of the judges, and also have been on the other side of the table as a former joint winner of the Cancer Experience of Care Award. So I have 3 tips for you today when you're thinking about preparing a successful PENA entry. So the first one is that I want you to pretend that all of us judges are actually aliens from another planet. And by that, I mean that we are not familiar with the setting in which you work or the context, okay? So what I'd like you to do is explain from first principles some of the terminology that you use every day in your work and you take for granted, but that us as alien judges who are unfamiliar with your specialty, we don't know. Okay, so just bear in mind that there is that element of unfamiliarity with your specialism. Now, as part of that, I would like you to road test your draft submission. Now, of course, none of you have a local alien that you can just call up and say, "Hi, Martin, would you please review my draft submission to PENA?" But what you can do is you can enlist family or friends, neighbours who are unfamiliar with your work, and you can ask them to give it a quick read and just highlight any terminology or any work speak that might need explaining in a little bit more lay detail. Okay. The second tip is I would like you to be as logical and methodical as possible. Now, Chris has already outlined all of the judging criteria, and what I'd like you to do is go through those criteria with a fine-tooth comb and literally tick each one of those off as you're preparing your submission. And the reason that I'm asking you to do that is because when you make it easy for us as judges to do the marking, you can make it easy for us to give you very good marks. Okay, now the third thing that I would like you to do is try very hard not to be modest. Now, I know that it is in none of your natures to be boastful or to brag about your work, and you will find it difficult to big up your project. However, it's important that you're not too shy. We do want to hear about your achievements. We really want to understand the massive difference that your work has made to your patients and all of your stakeholders. Okay, so give us the data, give us the quotes, the stories, the case studies, give us those survey questionnaire results, you know, everything that Ruth has already mentioned that will help to convey that powerful voice. Okay, and basically what I would say is, bottom line, think like a winner and you will write like a winner. So good luck to all of you with your entries, and don't forget the amount of resources and help and support and advice that's already been mentioned, that's there on the website, and that our colleagues are able to help you with. Thank you.
Azmina, that's brilliant. Thank you. I almost got caught up writing notes instead of chairing that. That was so useful. Excellent stuff. Some great advice. And pretend the judges are aliens from another planet is one that sticks with me. I'm going to go on to our next speaker now, though, who's Darren Hudson, a senior lecturer in medical imaging from the University of Exeter. And Darren, again, is going to be talking about what stands out for a good submission. Darren.
Thanks, Chris. And there is a slide here, it's just to prompt me when I'm talking, to be honest. But yeah, so I'm currently a senior lecturer. I wasn't moving into academia about 3 months ago, but I am a diagnostic radiographer by background, and I've been in clinical practice for over 20 years before shifting to academia. And it was interesting when Ruth asked me to speak today, because when I looked back, I'd realised that I've been judging on PENA since 2015, so it's almost, this will be the 10th year, and I've had the pleasure of working and publishing some work with Ruth over that time as well, which has been a great honour. And I guess one of the big things that stuck in my mind straight away was a comment that Louise made to me some years ago, where she commented on me being quite a harsh judge. And so what I will say is, for me as a judge, I do use the whole array of scalar points that Chris mentioned. So again, that wording is really important. And to me, it's very much about the evidence base. Where is the evidence that we've done something and what the impact has had? And again, as been mentioned already, it's very much about that story that we want to hear as well. So I know it's not about research, but with the researcher in me, I mean, basically what the slide's given you is a bit of a thematic review of the kind of things I looked at in last year's judging and some of the comments that I made doing that judging piece of work. So really, obviously, the first thing is around the relevance to the category that you've submitted to. Clearly explain how your project aligns with that category, and particular highlighting the challenge or the problem that it addresses. So it's important to try and make sure that you're explicit about your entry and make it crystal clear as to how it fits with that category. You know, those that didn't really align, or I really couldn't see the cohesion with the category that it applied for, those are the ones which kind of scored slightly lower. And again, you can always find an approach, or you can always find a category that you'll be able to fit in, as Ruth said. So it's important to tailor and tweak that narrative so it best fits the brief. I guess the two middle bits really are the key things for me, is about demonstrated impact and that stakeholder feedback, which again has kind of been mentioned already over the webinar. But a big aspect is, how does that demonstrated impact, how are we measuring it, or how are we showing that evidence at the end of the day as well? So again, where were you beforehand? Where have you been afterwards? And also, can you continue to measure that going forward to make sure you're sustaining that impact that you're having? And again, as has been mentioned, I do like a bit of quantitative evidence and numbers, but at the same time, I think particularly with these categories, it's really more important about the patient voice and their involvement, and that's really strong evidence in itself, particularly with the storytelling. And what is that measurement of success at the end of the day as well? One of the things I also would try and avoid is relying too much on indirect impacts. So again, when we had some of the categories last year, or some of the judging that I was involved in, certain indirect impacts were mentioned, but actually it's the direct impacts on the service or the outcome that you've had that's more relevant, and also saves you wasting words talking about something that doesn't really showcase the evidence of what you've done as strongly as other things could do. And then, as I mentioned, the second thing is really about that stakeholder feedback. And I've said stakeholder because, yes, a lot of the focus will be on patients, but even when we're doing work around staff experience, which is equally important, it's also useful to capture their voice. And I think on some of the categories that I judged last year, which was around staff in particular, there was a lack of staff actual comments and their feedback into what was happened as a result of those as well. So direct quotes are great, survey feedback, all those different voices are really important as well. And obviously how that feedback then shaped and influenced the project at the end of the day as well. The other kind of three categories I've kind of mentioned, innovation and creativity. Again, it's been talked about already. What makes it different? How does it stand out? And in particular, if it's a new approach, obviously digital tools and system impacts is a huge thing at the moment. And also, how does that then implement and link to other things? So again, is that transferable? How can it be applied to other areas or other professions? And it's useful to share your resources and the support that you develop, so we can share that for further rollout as well. And then obviously the last thing is sustainability. So how can you explain how the impact will be maintained long term? So we don't want this to be a short-term project that has an impact stopped and then loses momentum. How is it really embedded into practice for that long-term change? And how can you share your future plans of your ongoing evaluation efforts as it continues to evolve? So that's just some initial thoughts for me. Hopefully some of that's helpful. And really is very much about selling your project. And I guess the final thing I would say is just a shout out to anybody who is on the call, encouraging allied health professions to submit some pieces of work as well. As a radiographer who's one of the AHP groups, I would say we're underrepresented. And I think in these awards in particular, we don't see enough sharing of good practice from the AHP profession. So I would just put a call out to that to try and advocate some people to put some entries in. Thank you.
Yeah, thanks, Darren. And on that note, please do share this opportunity within your organisations. You're aware of this, but there may be other teams who are not so aware and may not immediately see the applicability. But actually, we're very agnostic to professional groups and sectors, and very keen to get a broad spread of entries. But thanks, Darren. That was really great. And what I particularly liked there, if I might spend a moment on it, is the focus on impact, which I think is very, very valuable. Without wanting to get too technical, really interested in the way you represent the logic model of what you've done. So it's easy to talk about the inputs that you used, the activities that you took, but what really, really stands out in a great entry is demonstrating the outcomes of the work and the impact that it has, the change for people who use your services. So that focus on impact is very, very valuable. Anyway, we come now to our last speaker, last but absolutely not least, Kate Tanton, Specialist Research and Education Sister in the ICU at Plymouth Hospital's NHS Trust, was our overall winner for 2024, and we'll tell you a bit about that, and there'll be some great feedback here, I'm sure. Kate.
Thank you very much for inviting me. So I'm here representing a big multidisciplinary team, actually. So this is a joint submission that we had from our teams in the neonatal intensive care, the general intensive care, and actually the whole organisation. So this is presenting the work of the Secret Garden that allowed us, and we won next year. Next year? God, that's proactive, isn't it? Last year. Next slide, please. So for me, I wanted to break it down and tell you a little bit about our submission. And actually, I'm very proud to say that we were the overall winner in 2020 with a Rehab Legend project, which was a social media product. So I've done 2 entries, and I thought I'd give you my top tips from both. So innovation, leadership, outcomes, and involvement and inclusion. And the thing for me is about, your patients, what they need, you see them every day, you work with your teams, you know what you need. So I think having a bit of belief in yourself and having a big idea and going and pushing for it, I think is the thing that I would suggest you do and really push you towards. Leadership, I think when you're leading a project and leading the good idea in your organization, you absolutely, as the judges have said, have to own that leadership. So when we were presenting and working on the stuff that we did in the Secret Garden, it's not being boastful, telling people the amazing stuff that you've done and the impact that you're making for your patients, and understanding all the nuanced leadership that you do every day is actually quite hard and takes some time to sit and think about the different leadership bits you used at different sides of the project. So really pushing and proving leadership, collaboration, and patient experience, embedding patient experience at the heart of what you're doing and how you're planning and how you're leading the project is really important, and leading it from a patient and participant perspective. Outcomes and sustainability. This is where data, I think, is really, really important, and making sure that it has the capacity to influence as many patients for as long as possible. And involvement in inclusion. This is everything that PICA and Penn are all about, and we're all about too, because in healthcare, we're none of us here for the money, the parking, or the uniform, are we? We're here because we fundamentally care about improving our patients' experiences and our services. So this is about our experience as the Secret Garden. Next slide, please. So I thought I'd tell you a bit about the Secret Garden. So if you didn't know what we won for last year, this is our patient who helped us design the garden. So we started off with a patient story. This is Andrew, and he was in a traumatic incident in West Africa and was repatriated to our intensive care. And the thing he most loved was being outside. He described himself as an outside person. And when he came to intensive care, he had been inside for 3 months, and he was desperate, and I mean utterly desperate, to feel fresh air and just to feel normal and to see his dogs and to see his family. So it was Andrew saying to us, back one slide, please, sorry. It was Andrew saying to us that he really wanted to be able to go outside. That was really, really important. So he helped us design the space. And we first identified a courtyard in our hospital in June of 2019. And then we opened it on Christmas Eve with a budget of £500 and money we'd got from a garden centre. We then, over 5 years in a pandemic, raised £800,000 and built a bespoke intensive care rehabilitation garden space with oxygen, piped air, suction, power, can't bend it, can't shake it, raised beds, everything that you might need to take anyone outside. And it was a patient co-design process. And from that, we created national guidelines of taking intensive care patients outside. And we are now looking at the clinical research outcomes of this space and the impact that it makes. And I'm actually doing a PhD in the impact of this space at the moment. But we were able to prove that we've created a space for anything, and this space is now used for neonatal, pediatric, adult end of life, rehabilitations, weddings, bar mitzvahs, you know, name it, and we do it outside in a fresh air space. And just being ill in hospital doesn't mean you can't use it. So I think when I said right at the beginning about innovation, if you've got a big idea and a patient tells you you want to do it and you know it might take you a long time, you should just still do it anyway. So this project from inception, which was July 2019 to when we won 2024, it took a long time to come, but we think it was worth it and we think it's made a difference. Next slide. So this is about grabbing the change. And this is my favorite quote of all time, because it is about this. Change will not come if we wait for some other person or some other time. We're the ones we've been waiting for. So I would say, grab your good ideas, share your good ideas, because the whole point is that we're making it better for as many people as possible. And when you're looking about transferability and dissemination and the data elements of how can I prove what my project's done and how much of an impact it's made, think locally, think what you've done locally for your patients, but then think about the national impact of the thing that you've done. And then, you know, I say world domination, but it is about that. Just, you know, when we started this project, it was with one patient and one patient's good idea. And now I'm doing national research work and pushing for gardens to be put in all the national guidance documents for intensive care patients. So this started as a courtyard in Plymouth, and I've now just got it written into national guidance that every ICU patient should have access to fresh air spaces. And I've clearly got a 5-year plan that it's going to be part of the NHS green spaces, because it matters, fresh air matters, and this project proved it. So next slide, please. So the final bit is, I'm a research nurse as well. So understand that data is a metric, that it can be your friend, and you can use lots of different types of metrics to get your impact. And for me, it's about sharing the right data in the right place. And patient stories are my top 3 of things that you should be doing. If you can share a patient story, you can make somebody feel something. And if they feel something, they will act something. They will do thoughts, feelings, actions. We've got to make people feel something. So make your judges feel something in your application, then bring them the data that they want. And if you can add a slice in of the economics of this has got this many patients through this space, people love economics. And that is, you know, I think it is the metric of how we make things better. And I used those 3 pillars to be able to get my garden built when I was trying to raise £800,000, and we managed it. Next slide. So finally, it's a thank you from all of my teams, and this is our multidisciplinary teams in intensive care and in the neonatal intensive care. And finally, to start off, you see the gentleman who's on the left-hand side. This is a gentleman who was one of the first patients to use our fresh air space in the July of the year we opened. And when I first met him, he absolutely was so very, very, very unwell, and so very, very, very delirious that he was unable to open his eyes. And 4 experiences of fresh air therapy, and he was discharged in 2 weeks. So don't underestimate the impact of the intervention you're doing. Don't underestimate the impact of the team that you work with, because they are all legends. And don't just think that leadership is something that you're not doing. You're doing it every day. Actually, all you're doing is finding the way to share the great work and share your colleagues' genius. So just start with your patients, start with your patient experience, come up with a big idea and just do it, and don't be scared. And then tell them, and then you win. Good luck, everyone.
It sounds so simple. I've heard this story before, but honestly, it's so moving and such an incredible example. Not every idea can be as big as this, but yeah, it shows how an idea can grow from a small start into something that, you know, changes national approaches and has massive impact on individuals and on systems. And it's a really, really wonderful example. If you'd like to find out more about it, I think I'm right in saying that Kate's presentation from PENA24 is available on the patientexperience.org website, and please do take a look at it. It really is very inspiring. And I think, you know, what stands out for me is that it would have been so easy to respond to that initial request to say it's too difficult to get you outside from the ICU, and instead to transform the approach for so many people. Remarkable. Thank you. going to move on now to questions and answers. So this is your opportunity to ask any questions that you might have of our panel, to explore any queries you have, to seek their advice and input. So there's nothing in the Q&A yet, but please do add anything that you'd like to. Alternatively, if you'd like to ask a question directly and you're not feeling shy, then raise your hand. It will bring you in, and you can just ask the question directly. We have had a few questions in our chat that we've dealt with, which are mainly about the practicalities. So yes, if you start a proposal, you can come back to it later. There's details of that in the chat. And there's some other links to useful resources there too. Whilst you're thinking up questions, would you use Chair's prerogative?
If we don't have any questions, Chris, I was going to say, do you want me to just run through a couple of the practicalities that might answer any questions people have got in the backs of their minds, or will email me later? Is that useful? Or
Alan, yeah, that would be really useful. Please do.
Cool. So in terms of the practicalities of actually putting in your entry, obviously on our website, we've got plenty of resources. We've got our category listings. We've got those marking criteria and judging guidelines that are all available for you to download and kind of keep in mind. The portal itself is where we take all our submissions. So once you've made or started a kind of profile on the portal, you can log in and out of that as many times as you need to. You don't have to complete all the questions at the same time. You can, answer a question, save it, come back to it later. You can also add different team members to that submission. So if there's multiple people that want to collaborate on an entry or check something before it's submitted, there's the capability of the portal to do that as well. All of last year's winners and previous years kind of winners presentations are available to watch either on our YouTube channel or on our website. So if there's something, a project on there that's sort of maybe similar to your own, or if there is something that you wanted to find out a little bit more about, or you're interested in entering a category and you think is mine the right fit, you can go onto our website and double check that there. We are here to answer any questions that you have while you're making those submissions. There is a word count on the submission form. It's 2,000 words, so which sounds like a lot, but it's across sort of 9 or 10 questions. And the first question isn't included in the word count. So the first question is just about your organisation and a description of what it is and who you are. But again, 2,000 words, it's not a mandatory word count and we're not super strict on it. But it does mean that between those kind of following nine questions that you've got plenty of time and plenty of space to kind of get across what you want to share. But also, on the other hand, we're not asking for war and peace. We're not expecting you to spend days and days kind of, prepping these answers. Our judges, we get a lot of submissions and our judges have got plenty to read through. So we try and keep it fairly standardized for everyone. One of the other things about supporting evidence, so there is the opportunity to upload up to 3 pieces of supporting evidence per submission. This isn't a mandatory thing, that's entirely optional. Some people choose to do it, some people don't. The supporting evidence that you can upload can absolutely vary. So tables, charts, I know one of the questions Emma's put in, that can be added into supporting evidence. The actual questions themselves tend to be text-based. So if you want to, add in any images, or if you've got like a supporting video, or you've had a co-created or co-produced video made, you can do that in the supporting evidence. And we encourage the judges to look at all that supporting evidence in relation to your entry. What I would say about the supporting evidence is not to solely rely on it, but put the bulk of your answers and what you want to get across in the submission, in the question boxes, and that is supporting evidence only, not sort of mandatory or kind of needed to be looked at. What else do people normally ask? Yeah, like I said, if there's any questions, or you're not sure about categories, or you want to submit the same project into multiple categories, you can absolutely do that. We would recommend that you tweak, if you're putting one project across multiple categories, we would recommend that you tweak each submission to make it category appropriate. But you don't need to start it entirely again. So if the basis of it is there, we would suggest that you sort of adapt it for the category that it's being entered into, but you don't need to start from scratch and start all over again. I think that's probably everything from myself. Like I said, we've got plenty of resources on the website. I'm always at the end of an email or the phone if anyone wants to talk anything through. So please do get in touch.
Thanks, Helen. A couple of additional comments in the chat there around the submission, the supporting material. Yes, please do put things like charts and figures into those, and if you can cross-reference them, personally as a judge, I find that really useful. So rather than just having supporting evidence that isn't explained in the entry, if you can signpost us so we can understand what we're looking at, that's really good. As Ruth says, try and cover the 5 judging criteria across each of the different questions in the form. Ruth, you've had your hand up for a while.
Yeah, I was just thinking, and thank you so much to our judges and indeed to our audience for your questions. I just find this webinar so invigorating because it just reminds us about what we're about and what we're for, and about the brilliant work. And Kate was a very worthy winner last year, as was Mina in her category in the previous years. But what I wanted to just flag, and Darren, sorry Darren, mustn't forget you, but I think winning is just part of it. It's actually taking the time to reflect and recognise the work that you're doing. Winning is lovely, but we do hear a lot from our the people who take part, actually simply taking part. And I know that this is something that we hear a lot, but genuinely we hear simply taking part has made a difference for the people because it's given them the recognition, and it's actually collated in one place what you have done, and already starts to be a really valuable resource back for your organisation, and in itself is a really powerful step. But as I was listening to Kate, which was an amazing project, and as you heard, was started in July of 2019, was hundreds of thousands and took many years to do. But as you're thinking about your work, it won't be all big stuff like that. It could be, and obviously can be. But we have had entries where one individual healthcare assistant, I think it was, identified that missing dentures was a real problem, massive for people's respect, and to have your teeth go missing because that you had to take them out for an operation and they're not to be found. So this was a simple project to find a way to make sure that people kept united with their dentures, saved the trust, tens of thousands and potentially hundreds of thousands over the year, but actually more importantly gave that person dignity and respect and really thought about their experience from their perspective. We've got submissions about the power of art or reading stories or bringing music into hospitals. We have examples of the end of life and really the end of life, the experience in mortuaries. We have examples of how do we make sure that travellers and the groups who find it difficult to get into hospital, how do they have access? And how do we improve their experience? We've got, how do we partner with John Lewis, with football teams, with Samaritans? Whatever your work, if it's really focusing on improving the experience for the patients or the colleagues, then it's probably in. That was just a few thoughts on some of the submissions that we've had. And please don't forget that final plea from Darren for allied healthcare professionals, and indeed, anyone who's contributing to the experience, and that could be carers, family members, other patients. We're a really, really inclusive family, and it does feel like a family when you take part. We really try to make sure that we look after you as one of our own.
Thanks, Ruth. That's really helpful. I'm not seeing any new questions in the Q&A or chat, but I've got one quick question for the panel, which is about working collaboratively. So a couple of panelists mentioned being part of a team, and a lot of our entries are from people working in multidisciplinary teams. I just wondered if there are any specific tips on how to manage that collaboration with colleagues to develop an entry, if there are any reflections on the process for that. And that's for any member of our panels. Feel free to just come off the mic. And
I would say that we were really lucky in our team that we've written all the guidance together as an MDT, and we wrote the application together. And as Ruth said, it was a really lovely, reflective piece, because we didn't submit because we thought we were going to win. We submitted because I wanted to take a moment make everyone realize how far we'd come. And sometimes it's only when you pause as a team that you realize how far you've come. And it's only when you write it down and you see it and you hear it from your patient stories, and yes. And it's because I think maybe for us, because it happened over COVID, it was even more layered. So I think for us, it was a really, really, really lovely process. But I think the practical thing I would suggest is making sure you all take the time and booking time in a space together and prioritizing it. Prioritizing your team outputs is the right thing to do. And I think sometimes in the NHS, we think, oh, we can't do that because we must. There's always so many competing pressures. So I would recommend spending time as a team doing the application, because that reflective process, I think, is a really useful thing to do together. And it's also really important for the team.
Thanks, Kate. That's really valuable. Azmina.
Just to add to that, if anybody is worried about not having the space in the word count to acknowledge everybody that has supported you with your work, that's what your additional supplementary evidence, one of those documents, can be a nice list thanking everyone, just like they do at the Oscars when they make their speech. So please don't feel that you have a difficult decision to make selecting who are the prime actors in your project, because there's always space to acknowledge everybody who supported you and encouraged you and cheered you along on your way.
Thank you. Azmina, you mentioned in the chat about the pride you feel when you submit an entry, and I wanted to kind of pick that up and ask other panelists as well how entering or winning has had a positive impact for you. What difference has it made to you, apart from that kind of having an opportunity to reflect with pride on what you've done? Have there been other benefits as well?
So, Chris, I would say, as well as the pride, and it's already been mentioned, just that process of reflecting on how far you've come and acknowledging that all of that blood, sweat and tears has actually been worth it. It's really helpful just to raise the profile of your work more generally, having done the entry, and you can use bits of the submission for other things like your annual report. Even as an individual, if you're applying to do a master's or a PhD, some of those paragraphs will be useful. So it does actually have a ripple effect throughout the organization, beyond your team and beyond yourself. So please don't think, oh, it's 2,000 words, it's like writing an essay and I wasn't good at being a student. No, that's not the approach to take. There are so many benefits from just putting pen to paper. You don't have to write sophisticated sentences. As we've already said, it's not a research report. Just deep breath, get the pen ready or the keyboard ready, and just start giving it a go.
Thanks, Azmina. That's brilliant.
I would say it opens doors. I think it opens doors. I've managed to get into doors with it and said, well, we won last year. Can I tell you about it? And that doesn't matter whether it's with your boss, with your boss's boss, with the chief exec, or with the region, or nationally. We've won a penna. I want to tell you about it. I want to be able to bring this for other patients. So I think sometimes just wear the badge with pride. It's not showing off, it's improving patient experience.
Wonderful. Thank you, Kate. And I think that's been a clear message throughout, actually, that you should take pride in what you've done. Don't worry about being boastful. Don't worry about being immodest. Actually, there are things that we all do that should be celebrated, and it's good to be proud of them. I'm conscious of time. We're almost at the hour, and we will try and wrap up in a moment. I just want to ask panelists if they've got any final top tip, very briefly, before we conclude. Darren, I'm going to put you on the spot if you don't mind.
Well, I guess just to reiterate what I've mentioned on the segment that I did, it is demonstrating that impact, whether it's figures or patient stories. I think that the bigger the impact, or the more you sell that impact, the more powerful it is and meaningful to us as judges when we're reading them.
Thank you. Absolutely agree about impact. Azmina?
Just to recap, remember that the judges are aliens. We come from another planet. So we want to understand your work, be methodical, and exactly as already has been said, please don't be shy. On planet Alien, where us judges live, we don't do shyness and we don't do modesty. So sing your own praises and sing them loudly and proudly.
Brilliant. Thank you, Kate.
I was just going to say, just do it. Don't think about it too much. Just do it. Just start. Starting is the hardest thing always. Just start.
Yeah, that's a brilliant one. Thank you. Ruth, I'll come back to you in a second if you don't mind, but I think you've covered a lot of what I wanted to pick up as top tips there. So, pretend the judges are aliens from another planet is brilliant. Find what makes the heart sing. It's about passion and it's about personal impact and experiences. So the more you can demonstrate that, the better, as Angela commented. You banish modesty, be proud of your achievements, and believe in yourself. Be ambitious, and above all, just go for it. Just do it. You won't regret it, but you may feel that you've missed something if you don't. I think that probably covers us, and that's us at time now. So I'm going to just try and wrap up there. I've got a few brief housekeeping things to cover, which I'll do before we finish. But first, Ruth, I want to come to you and ask if you've got any final words or reflections.
My final words are echoing Kate's, which is if you think you've got something great, which you almost inevitably will have because there's pockets of brilliance everywhere, then we would really, really love you to just do it. And thank you so much to our judges and to the panel today. And thank you to you for joining us.
Yeah, absolutely. Let me echo that. Thank you very much if you've been with us through the entire session. I understand that some people have had to drop off. Just the housekeeping bits of note on the timetable and some of the practicalities. So the recording for this session will be available via our events website, pickhead.org/events, as soon as possible. I think we'll be circulating that via email to everyone who is on the sign up list for this, so you should get access to that quite soon. Where we've also shared in the chat the link to the information about the awards on the PEN website. So that's patientexperiencenetwork.org/awards. You can find all of the details about the different award categories and about the judging there. Crucially, within that, you can find details about the timetable. Applications are now open. The submission deadline is up there on screen. You can't have missed it. It's the 29th of June, so that's 2 months from now, a date for your calendar. We'll then announce the shortlist from the 7th of August. And the awards themselves will be on the 2nd of October at the University of Birmingham. Really hope to see a lot of you in person. There is always a really special day and a highlight of my year, and I know of many of us too. I think that's all I've got to say. I want to thank you all again very, very much for spending this time with us, and a big thank you to all of our panelists and speakers for talking through their experiences and providing such insightful reflections about what it takes to make a good entry. I really, really hope you found this useful. If you have any feedback for us, please do share that. We'd be delighted to hear it. And if you have any more questions about how to enter or about the awards, please get in touch. We'd love to help you. And that, I think, is really it. Thank you very much. You're free to leave.
Thank you.
Thank you.
Thank you.